So this is Larry. Larry, how old are you now?
74.
So Larry's 74, and he's had this that's developed over the course of the last couple weeks, maybe month and a half. Originally it was more of a small scaling lesion, and as you can see, it's now built up quite a bit around the base and has this central evolving area, or almost, if you took this off, it'd be a little bit ulcerated. So you can think about this as I'm talking about it in terms of what this may or may not be. This is actually a variant of a squamous cell cancer, what we call a keratoacanthoma. So again, it's related to a squamous cell cancer. It derives from pilosebaceous cells. It's very slow growing. It's not, with skin cancers, you have to keep in mind the fact that you don't want to be dealing with anything that's melanoma in origin, and that's not what this is. So certainly it's important for us to take this out, and because it's a cancer, we want to make sure we have good margins. So with other skin lesions, we're always looking to make sure that we take as little tissue as possible. Here we want to make sure that we take out all the tissue margins, because when I send this to pathology, if it's not completely excised, then we have to send him to either a plastic surgery or general surgery backup to do a more extensive excision. So again, the same rules apply, however. If we're going to take this out, we want to do as clean a job as possible. We talked before about Langer's lines, which are the lines in the connective tissue that parallel the underlying muscle, and they'll dictate to you whether you would do a horizontal incision like this or a vertical incision. And you can see when I squeeze this forward where his skin bunches, this would be better done with a vertical incision along these margins. So he's already frozen. So again, in this particular case, we've used an epinephrine in the xylocaine. So xylocaine works well. Epinephrine works better because it's also a vasoconstrictor, so you have less bleeding. The only times you can't use epinephrine is if you're dealing with end artery supply, which is where the blood vessel doesn't have any collateral circulation. So that's with the fingers, the toes, the penis, the nose, and some areas of the ear. So we're going to make an incision now. I want to start at the apex, and you want to have an elliptic incision. So I'm going to make an incision here. That doesn't hurt at all, Larry?
No, not yet.
It shouldn't be at all. And when you're doing your incisions, it's best if you can have one fluid motion as best you can. Now, it's not the end of the world if you can't, but it's usually cleaner with the scalpel if you can. And you want to make sure you cut right down to in your subcutaneous tissue so that this floats fairly freely. If it feels adherent to the underlying tissues, then you're clearly not deep enough. Now, even though this looks like sort of a big volcano here, this is kind of the reverse effect of like an iceberg phenomenon. With keratoacanthomas, it usually doesn't run very deep, so you should be able to get under it without too much difficulty. I'm just going to pick this up, and I'm going to start from the apex here and work backwards. And you can see that's all subcutaneous fat in there. That's all that tissue is, and that's what we want to see, because I don't want to be seeing anything that looks like it's adherent or dangerous or anything from that perspective. So what I should be cutting through here all the way along, because I'm in the subcutaneous tissue, is all adipose or fat tissue. You can see that here, that's more of a yellow sheen, and that's what I want to be seeing. You can see that cleaned up. So you can see all through there, it's all adipose tissue. There's nothing that looks worrisome. So this was again sitting right through here, and that's out now. And if you look at the back of it, you'll see that that's all adipose tissue. So it doesn't look like there's any sort of cancerous potential that's sort of adherent to the back. So now we'll just suture this closed, and this is the other note too. If you're not deep enough, you can't get this to close together. But because I am, what I'll be doing is I'll be sealing it at the 2/3 and the 3rd point, and then it'll be easy to get across the middle. All right, so we'll let this turn off, and then I'll show you the final product in a minute.